I'm Ran Yam, CEO and co-founder of NovaSight. So NovaSight is a global leader in providing digital solutions for pediatric vision care. Established in 2016, we have 21 employees, 27 granted patents, 2 approved products. We raised so far $30 million. You can see some of our well-known investors on the lower end side. And we have 2 global subsidiaries, 1 in the US and 1 in China. So everything that we do at NovaSight is based on 3 building blocks. First, eye tracking technology, either infrared sensors or through the integrated cameras of devices through an AI-based eye tracking, data analytics, and cloud connectivity. So we're engaged in 3 different segments of the market. The first one being diagnostics with our IceFit Pro vision diagnostic device. The second is treatment with a CureSight lazy eye amblyopia treatment device, which is CE-marked, FDA cleared, and I'm happy to announce here for the very first time, just a few days ago, we also got the NMPA clearance for China. Also on our pipeline is a solution for prevention monitoring of myopia. It's a fully digital solution that I will explain more about it later. Starting with the CureSight lazy eye treatment device. So lazy eye affects about 3% of the population. This is the leading cause of vision loss in children. Left untreated, it would impact most of the quality of life aspects of the grown-up. And the gold standard treatment today for amblyopia is patching over the strong eye in order to force the brain to work with a weak eye. But it's very easy to understand that patching suffers from very low compliance. Kids hate a patch. Here you can see our solution. It's CureSight device. It's a home treatment for amblyopia. The black strip below the screen is actually the eye tracker that is tracking the gaze of the eyes, while the kid is wearing the blue-red glasses and watching his favorite content, which could be everything streamed online, so Netflix, Disney, YouTube, whatever the kid likes to see. We blur the center of vision of the strong eye only according to the momentary gaze position. Now, the size of this blur and the intensity of this blur are corresponding to the level of amblyopia and also keep changing according to the progression of the kid of his visual acuity. This was tested in various clinical trials. We just submitted or published the latest randomized controlled study showing superiority of our treatment over patching. This was published very recently in the American Journal of Ophthalmology. And we launched the device last year, 2023. It is supported by the American Academy of Ophthalmology that actually changed their guidelines of how to treat amblyopia based on our study. We have more than 400 physicians already prescribing the device, 43 active states in the US, over 1,300 referrals done to date, and over 1,700 claims, insurance claims that we submitted in our journey to get reimbursement. In Europe, we had a small launch in Italy and Israel, and now we're working on preparation of the German market, which we expect to have a full reimbursement for the device. In China, as I said, we just got the approval, and we are now preparing for the launch in Italy and working with a local distributor. Now moving to the myopia control application called TrackSight. So I think, as most of you know, myopia is an epidemic of the 21st century, impacting today about 3 billion people, and is estimated to impact more than half of the global population by 2050. In China, today, more than 85% of teenagers are suffering from myopia. There are currently a few solutions to treat myopia, the first one being a pharmaceutical solution, mainly atropine, and then we have optical solutions, namely contact lenses and spectacle lenses. Now, the spectacle lenses are very interesting. This is the fastest growing segment in the market, and there are 2 main solutions, 2 main technologies for the myopia control lenses. The first one is myopic blur, an array of positive lenslets scattered on the periphery of the lens, creating peripheral blur. And the other one is contrast reduction. In this case, scattering elements diffuse the light and actually reduce the contrast in the periphery of the lens. Both of these solutions were proven in various clinical trials, and today, even today, the market for those lenses in China is already $3.5 billion, estimated to grow to $9 billion by 2030. However, there are 2 main caveats for this. The first one is that there is a trade-off of the clear aperture in the center of the lens between comfort and efficacy. And also, the glasses are removable when children are watching screens, and usually they don't need any solution, they don't need any correction when they're watching screens at near vision. So on the most important time of the day, they might not be treated. And also for pre-myopes, only starting the myopic process, we have no solution today because parents are reluctant to use any kind of solution because of cost, convenience, and appearance. For this, we developed the TrackSight application that you see here. So it is running always on the screen. If you look away from the center of vision of the eye tracker, you see that there's a degradation on the peripheral vision. Actually, we're simulating the solutions of the glasses to the digital space. This is working at all times on any consumer electronics without any additional hardware. So we're using the camera of the device to always protect the vision of children whenever they're using any kind of a consumer electronic device. So working on any device, any content, potentially higher efficacy because we can make a smaller clear aperture on the screen, cannot be removed by the children like the glasses, and hopefully meeting the unmet need of pre-myopes, because why not use any kind of digital solution even before the kids are myopic. In terms of commercialization, the technology is patented in the US and rest of the world is pending. We're starting a clinical validation already this month in a choroid thickness study and a full myopia prevention study for pre-myopes early next year. We can already early commercialize it as a wellness application well before it is regulated. We have a very strong management team and experienced scientific advisory board, and currently we are raising our 10 million B round. The lead investor, Infinity Global, is investing 4.5 million, and we are looking for additional investors. With this, I thank you for your time and for your attention.